The first time mama, I thought I had it all figured out. I thought I was smart enough to learn for myself. But take it from somebody who went in to have a natural birth and it ended in an emergency C-section. There are so many things that I learned from that situation. So in this video, I want to tell you 10 things that I wish I knew as a first-time mama before giving birth. Hey mama, welcome back to my channel. My name is Chanel. I am a wife, mama of 3, doula, and this channel is meant to help you go from a place of feeling overwhelmed, unprepared, even uneducated for birth, and walk into birth feeling confident and knowledgeable and empowered to have the experience that you desire. So on this channel, you'll find lots of birth education videos, birth stories, and even my own personal journey going from pregnant into motherhood. I hope that it inspires you to have the experience that you desire because you are capable of that all on your own. Now, I want to stop and say, if you have been supporting this channel, please know from the bottom of my heart, I am so grateful. This channel would not exist without you. I hope that all the information and the knowledge that you are getting is comprehensive and it is a key to helping you prepare for your birth. Whether you're choosing to hire a doula or just going in with you and your partner, I do hope that this information is helping you feel a little bit more at peace and at ease as you go and navigate this beautiful journey called motherhood. Now, the reason that I'm making this video is because there's so much that I learned from my first birth to my third birth that made such a big difference from me leaving my first birth experience very traumatized with a lot of birth trauma to feeling so empowered with my second and my third baby that I fell in love with giving birth. And I wish that there was a video out there like this when I was preparing as a first-time mama, because most of my knowledge came from the internet. And I will talk more about that throughout this video, but I want to share 10 tips that would have helped me avoid birth trauma the first time around. Now, the first thing that I wish I would have known when I was preparing to give birth the first time was that preparing myself actually started from the time that I got the positive test. So many people come to me now as a doula and they are past 30 weeks, and there's nothing wrong with that, but there's so much that goes in to preparing for birth within those first 30 weeks that I really urge people to start the prep process very early. You could even start your journey of learning about this process, about birth, about what you want before you even get pregnant. And a lot of moms have followed me for many years before they even got pregnant, and then we get to work together to really refine what they want when it actually comes time for them to give birth. But I want to encourage you that if you have gotten that big fat positive, no matter where you're at in the journey right now, begin learning. That could be listening to podcasts and starting to familiarize yourself with the language of birth, listening to birth stories that are positive so that you can begin to get a vision of what is possible in birth, because there's so many stories that we hear from friends and family that are just very negative. And they're scary and they're not really empowering when it comes to preparing us for birth. And that's not to say that those stories are not valid and that they don't matter. However, coming from somebody who had a traumatic birth experience, I had a painful birth experience my first time around, and it was not a positive story. I know that if I would have heard my story as a first-time mama, it would have not gotten me closer to my goals of having a natural birth. And I was very narrow-minded when I prepared for my birth. And there's certain things that we can be doing throughout each trimester as we prepare for birth. From the very beginning, if you are nauseous, I am not expecting you to read a bunch of books in your first trimester. If you are just struggling to have energy, I am not expecting that much. However, what you can do to prepare for birth in the first trimester is really learn how to listen to your body. What is your body telling you? Do you need to rest? If it says rest, then rest. Do you find that getting up and moving around helps you actually feel better? Are you listening to that? It's really important and key in labor to know and trust your body to tell you what it needs. And if you can start doing that from the very beginning, even if you're feeling super nauseous and sick, which was my story, the first 2 times around, I threw up multiple times a day, probably up until 16 weeks with my first and my second babies, and it was rough. But what I learned is that my body is communicating what it needs. And that could be the type of food that it needs. That could be that I'm not hydrated enough. That could mean that I need to rest. That could mean that I need to move. But there are certain things that we can do through each trimester. So I encourage you to start your prep process from the very beginning. If that means hiring somebody to help walk you through and guide you through what you should be focusing on each trimester, that is an option. That is how I support my clients in my Work Your Birth program. You can check that out below. It really helps to not have to think about so much. And because of the type A personality that I was and that I am, I wanted to just do everything by myself because I figured my body is made for this. I can do this by myself. But I don't think it's a good idea, from experience, to try to figure out what this whole thing is about on your own, because you're probably going to miss something, and Google is not going to tell you, nor is YouTube, unless you really know what you're looking for and what you need to know. And most of the time, we don't know what we need to know, and we don't know what we don't know until we need to know it. So I encourage you from the very beginning to start getting educated. The second thing that I wish I would have known is that although my partner was not the carrying, birthing person, he needed to know just as much as I did. And I made the mistake of telling my husband that I was just going to let him know what I learned, or that he didn't really need to pay attention too much in the hospital birth class that we took because he's not the one giving birth. And as a mother, as a birthing mom, as the person who's going through the whole experience, it is really difficult when you're in the moment to always communicate what your needs are, to communicate what you want your partner to do. And that is what situation we ended up in. I wish that I would have told my husband to pay more attention in the birth class. It was extremely boring, so I understand why he was not paying attention. But I wish that I would have had him looking at all of the different resources that I had. I wish that he would have been reading the books. I wish that he would have been listening to the podcast. I wish that he would have known just as much as I knew, which I really didn't know that much the first time around, but the second and the third time, I saw the difference of when he truly invested himself in the knowledge and the education about the birthing process. Because what that allows is for your partner to actually speak up for you. It allows for you to be silent and to birth in your birth zone, and for them to be able to look at you and know exactly what your needs are, to know exactly what to suggest to you. It also allows for them to advocate for you. Because if somebody in the hospital, a nurse, an OB, somebody who's a resident, whoever this could be, comes in and wants to suggest something to you to either speed up the process, to get an epidural, to try to scare you into doing something that you're not even comfortable doing, it's important that they understand that language and they can speak that language. I am not saying that you need to pretend that you're a doctor, but what I do believe is that you should be able to speak the language of the environment that you're going to be in. And all of the clients who I'm able to prepare are able to do that. They can see right through fear tactics. They can see right through somebody trying to convince them to do something for their convenience and not for mom's. They know how to look at mama and say, okay, her baby's probably in this station. We're going to do these movements. They know how to say, it's probably time for us to go to the hospital without mom saying anything. And coming from somebody who was in labor the first time, and my husband was rubbing my back, he was there for emotional support, which is important, but he's like, what can I do for you? What do you need from me? And to hear that question over and over again gets really annoying in labor when you're just trying to get through a contraction. I wish that he would have known how to best support me. And thankfully, we figured it out the second and third time around because we got way better coaching, we got way better guidance, we had a way better birth team, and it really made the biggest difference. He didn't even have to say much. I mean, I don't remember my husband saying much at all throughout my second or my third labor. He probably didn't talk much at all, but I felt him so close. I felt his support. I felt so secure and safe with him that if anything were to happen, that he knew what was going on. So it's important to make sure that your partner is just as invested in the learning journey as you, because they have to understand that they are a part of this too, and this is their baby. And just because they're not pushing the baby out, They have to be your advocate. They have to be your voice, and they can't be your voice if they don't know what to say. The third thing that I wish that I would have known is weight gain is really not as serious as people make it sound. In all 3 of my pregnancies, I have gained 50 pounds, no matter how much I worked out or didn't work out, whether I was not eating meat and vegetarian or pescatarian to eating all the red meat in the world. All of our bodies are different, and it is important to make sure that you are eating healthy and giving your body the right nutrition and not eating things that are going to cause potential complications or health concerns down the road. However, understand that if your body just tends to gain a little bit more weight than the next person, all of our genetics are different, all of our body makeups are different. I've heard providers say that they are concerned with mom's weight and that she should start calorie cutting. And I just think that's the most toxic thing that you can tell a pregnant mom who's already trying to figure out like how to adjust to this growing body and growing baby. So if you are concerned about weight, I just want you to be encouraged that if you are doing the right things to take care of your body, like exercising and eating well, if your body gains a little bit more weight, that just may mean that your baby needs you to have a little bit more extra stuff to help the development and the growth of your baby, and it will come off eventually. It may take longer than somebody else, or it may not, who knows? But as somebody who has gained 50 pounds in every single pregnancy, I will tell you that no matter what I tried, we ended up in the same position. And I am anticipating that's gonna happen this time around too, but I'm not focused on it because it's too much for me to carry and it is too much for you to carry as well. On that note, the fourth thing that I wish that I would have known before going into birth is that exercise is crucial, but it has to be very intentional when you think about exercise. My first pregnancy, I worked out hard. I worked out like I was not even pregnant, and that is safe to do. I want to call out here that if you are a CrossFitter, if you are a runner, if you do HIIT workouts all the time, like those are still safe to do. If you lift weights, those are safe to do. I still lifted weights extensively in my first pregnancy. However, there's something else that has to go along with that, because for those of you who work out, you're probably one that has a very tight core because you understand the importance of core strength. If you don't work out, that's okay too, but I also want you to keep in mind the importance of exercise when it comes to reducing potential complications down the line, like preeclampsia, high blood pressure, other things that can help with the development of potential complications. So understand that exercise is crucial, but you do not have to go to the lengths of CrossFit, and CrossFitters, you do not have to stop and start doing walking and Pilates and yoga 100% of the time. However, in both cases, both of us have different types of cores. Some of us have really tight cores because we are used to squeezing our core and making sure that it is really solid and strong for our workouts. On the other hand, some of us don't know how to hold our cores and make it even tight. And so what comes into play here is making sure that you understand how to connect with your pelvic floor to learn how to relax it and release it, so that when you get into labor, your baby is not fighting against really tight pelvic floor muscles because all you did was work out. And that was the mistake I made in my first pregnancy, was that I worked out because I wanted to have a strong core. I wanted to recover quickly, which it did help me recover quickly, even with a C-section, because I worked out so often. However, my baby was really trying to push through some tight pelvic floor muscles, and I did not know how to relax them in labor. So if all you're doing is contracting or doing Kegels, and you have a really tight core, then you're actually doing more damage and making it more complicated for yourself. And we'll talk about providers in a second, but I want you to understand that exercise is crucial, but make sure that you're doing it in the proper way to not only help strengthen your core, but also learn how to connect with your pelvic floor in the proper way that is actually going to be most ideal for birth. The fifth thing that I wish that I would have known is that there are 5 key people that you should have on your birth team. And the first time around, all I had was 2. I had my provider and I had my partner. And there were 3 other key people that would have made a huge difference in my birth. And those 3 key people are who I decided to hire for my second and my third births. And it made a huge difference. The first, of course, is your provider. You need to be on the same page as your provider. If your provider does not support the type of birth that you want, does not support the belief system that you have, does not support the experience that you are working towards, they are not the one for you. I know they may be within your insurance network. I know they may be the closest one to you, but I'm telling you from experience, if they do not align with what you want and they make little comments that say, oh yeah, all my clients say they want to have a natural birth, or they end up getting an epidural, that's a red flag. And I'm telling you, because that is exactly what my provider told me, that they may be great people. And you may have seen them for all of your life, and they delivered all of your sister's babies. They delivered you. They delivered your mom's babies. I don't really care. If they don't align with the kind of experience that you are looking for, stick with them for women's health, but maybe they're not the best person to deliver your baby. And there are no hard feelings. I know it's hard to separate from a relationship that you've really established for a very long time. They've done all your PAPs, they've done all your things, but they might not be the right person for this experience. So your provider is super important. I give my clients a list of questions to interview their providers, even if they've already started working with them, to make sure that they're the right provider. Because you gotta know that this is gonna be the person who, when times get tough, if you get into a situation in labor and you're like knowing that you wanna have a natural birth, but you start calling out for an epidural, I've seen providers who know that their clients want that be like, hey, I know you don't want that. Here's some things that we're going to do. Here's some other options that we're going to exercise before we actually go down the path of an epidural. And if you want that, absolutely, by all means, get that. But I've seen how providers can completely switch it up and be like, sweetheart, let's just do an epidural. Let's just start getting this baby out because we don't want to go past 40 weeks and da 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 da. And there's no medical reason for it other than convenience and all that they know how to do. So it's important to have a provider who is aligned with you. Number 2 person on your team is, of course, your partner. Your partner, like we mentioned before, has to also be on the same page with you, because if your provider is not there, if your provider does some bait and switch and switches it up on you and really completely gives you different energy in labor, if a nurse tries to come in and really throw off the energy of the room or try to pressure you to do something you don't want to do, they got to be able to speak up for you. So your partner being educated and invested is key. The 3rd person is a childbirth educator or a doula. This can be one and the same. This could be 2 separate people. This could be one or the other. As a doula, it's going to be crazy that you hear me say this, but I don't believe that every single person needs to have a doula in the room with them when they give birth. And I know that sounds like, why would she say that? She's a doula. This is what she does for a living. But I've seen probably 75% of my clients birth without a doula. And the 25% of those are the people who I was actually supporting in person, who were local to me. But to be very honest, I prepare all of my clients the same. And it is because partners are capable of being the doula in the room. You do not have to be a certified credentialed doula to know how to support a woman in labor. Yes, those things are helpful. Yes, you go through a lot of training. Yes, you go through a lot of practice. But the reality is there are some key factors that every partner should know, whether they're a doula or not. And I teach all of my dads, all of my partners, I call them daddy doulas, because they have to be the one to still know the information, even if a doula is in the room. Because the doula can't birth for you. The doula can't make executive decisions for you. We can speak up for you. We can advocate for you. We can provide comfort measures. But so can your partner. And they should be able to do that, because if something were to ever happen with your doula, you have to know how to fill that gap. The doula is supposed to be there to support and empower the things that you already know, not to be the head or keeper of all of the knowledge in the space. So having a doula or a childbirth educator to prepare you and your partner along the way is key. That means that they're preparing you for the birthing process, that you understand everything that you need to know. You need to understand how to navigate the hospital setting. You need to understand how to advocate for yourself. You need to understand what is normal and what is not normal. That is what a childbirth educator who's actually trained in physiological birth, aka knowing how to trust your body and not just being a patient at the hospital, that's what they should be teaching you. And if you can have that extra person in the room, amazing. But I think that sometimes women feel like they can't have this experience that they want because they don't have doula in the room. And that's just not the case. And like I said before, 75% of my clients who go on to have really amazing birth experiences do it with just them and their partners. I am not in the room with them. There's a good 25 to 30% of people who I am in the room with, but even still, I have already empowered that partner to play that main support role because this is their baby, not mine. And I'm obviously there supporting, and we are really doing this thing together. But what you will learn is that the more people that you have in your space who don't actually align or you really have solid trust with, the more it can actually impact your birth experience. So having somebody who knows you both and can prepare you both is really, really key, especially somebody who can walk with you through that journey up until that big day. But know that you don't have to have somebody with you on the big day to have a positive experience. But having them on your birth team throughout your pregnancy is really key, and also somebody who can support you in the postpartum. The next person that you should add to your birth team is a Webster certified chiropractor. If you do not have a chiropractor in pregnancy, please go get one right now. Make sure they're Webster certified or know how to work with pregnant women, because your body is going to move. That's why so many people talk about being uncomfortable in labor or being uncomfortable in pregnancy with SPD or pelvic girdle pain, or you just can't walk because your pelvis feels like it's going to crack. It is because your body is not aligned. It is because your body is growing this baby, but you have not actually supported the growth of the baby with your body, and your spine and your pelvis could be completely out of alignment, which makes it actually harder in labor. So please hire a Webster certified chiropractor as soon as you can. I don't care how early you are in your pregnancy journey or how late you are, any adjustment will be helpful. And then the last person that you need to have on your birth team is a pelvic floor therapist. If you do not have a pelvic floor therapist, we talked about this with exercise. If you do not have a pelvic floor therapist, you could be doing too much, or you could not be doing enough in pregnancy. And you hear a lot of people talk about Kegels. Y'all, Kegels are not for everybody. I was Kegling my way through my first pregnancy, and it did not help because my baby had some real tight muscles that they had to try to push through. And that's because I had such a strong pelvic floor that I didn't even know how to release it. So a pelvic floor therapist can really help you learn how to breathe properly, learn how to connect with your pelvic floor, learn how to do proper exercises for your pelvic floor, and learn how to prevent yourselves from tearing, which nobody wants to do. That's one of the biggest fears out there. So having a pelvic floor therapist can help. Tip number 6 is going along the lines of something that we just talked about, things that I wish I would have known. It is that education is the key to a powerful and beautiful and positive birth experience. And when I say education, I mean comprehensive, full spectrum, in-depth childbirth education. And this is not going to happen in 2 hours. It's not going to happen in 2 hours. I'm going to repeat myself. It's not going to happen in 2 hours. And most hospital birth classes are somewhere between 2 and 4 hours. You're not going to get everything that you need from a hospital birth class. You're not going to get everything you need from a free class online. I'm sorry, and I wish that it was true, but it's just not. Because the reality is there's so much in birth that requires you to advocate for yourself, that requires you to sometimes push back on recommendations, that requires you to trust your body, that requires you to know how to move, that requires you to know how to listen to what your body's telling you to do. When to leave the house, how long to stay at home, when to push, when not to push, how to say no, how to know what questions to ask. And those things are not going to be taught to you in 2 hours. It's not. How to breathe. It can't be taught to you in 2 hours. And what I learned is that my 2-hour, 3-hour hospital birth class that we took the first time around only taught me how to be a good patient. It taught me what I had access to in the hospital, which those classes are important because you do want to know what you have access to, and you want to know what kind of environment you're walking into. But the reality is that just taught me how to abide by the policies and the rules that were in that hospital. And I gave birth at a great hospital, okay? So I am not downing hospitals. I am just saying it is one class that you can and should take so that you understand your hospital, but it is not going to actually prepare you for birth, because a lot of the things that I was taught in that class, I didn't actually end up being able to use. They didn't let me use the shower like they said they would. I thought I was going to have access to all these other things. That didn't end up happening. And we didn't know how to advocate for ourselves, because why would a hospital teach you how to push back on the things that they recommend or their policies? They wouldn't. And as a woman who is going into birth, who wants to have a natural physiological birth, and that just always doesn't happen in a hospital setting, or it's harder to happen in a hospital setting, let me say that, you need to know how to navigate that space. You need to know how to feel comfortable laboring at home longer. And so I want you to just invest yourself. If you're going to just do all the books, read all the books, that's cool. But try to get somebody who gets to know you and your plan and helps you actually work towards that plan. And that takes time. That is why I told you at the beginning, like, you should start this journey from the very beginning when you get that positive test, to work along somebody who's going to give you all of the nuts and bolts of this whole process so that you feel empowered to go and do it on your own, because you're capable of that. But you can't do that if you don't have the knowledge. The seventh thing that I wish that I would have known is that birth is best when it's uninterrupted. Birth is best when it is undisturbed. Birth goes best when it is intimate. And the problem that I ran into the first time around was that I wanted like as many people as I could have in the room. And a lot of people wanted to be there. So I had my cousin there. I had my mom there. I had my husband there. And then obviously we were at the hospital. So there was a lot of nurses coming in and out. There were residents coming in and out. And what I did not realize is that I was hearing so much noise. Obviously, I'm in a hospital, so I hear all these machines, but I'm also hearing all this advice from all these other people who actually did not know my plan and had never done what I wanted to do. And so it was really hard, because when you understand the birthing process, you understand that people, animals who want to have this natural physiological birth, they do it best when they are uninterrupted in a silent, dark, and safe place. And in the hospital is the complete opposite. It is loud, it is bright, it is cold, and there are a lot of people. And so I wish that I would have known that if it was just my husband and I in the room as long as possible, it probably would have gone better. Or if we would have been at home from the very beginning, it would have gone a lot better. And we could have done that had we known things, had we been educated. I wish that I would have known in that space that starting my birth at the hospital being induced was not medically necessary and actually was going to completely make the whole process harder. That we should have gone home in our own safe space and labored a little bit longer. That he should have asked people to leave. That we shouldn't have allowed our family members to be in the space with us, because it was going to make me really pressured and overwhelmed to try to make this thing happen as fast as possible, because they all wanted to see the baby. And I just wish that I would have been more patient with myself and allowed myself to be in a safe, quiet, uninterrupted mental and physical space, so that I would not have felt so much pressure and then ultimately slowed down and stalled the labor process. The eighth thing that I wish that I would have known is that I needed to prepare for all scenarios. I prepared for my best case scenario. I prepared for my natural birth, how to move during my natural birth, how to breathe during my natural birth. But like when it came even to that hospital birth class, I checked out when they talked about epidurals. I checked out when they talked about C-sections, because I was like, I'm not doing that. That's not gonna be my story. I'm strong, I'm fit. Like I can do this. I have endurance. And so when they started talking about those things in the class, I zoned out, because I was like, I'm not even about to expose myself to this stuff, because it's just like not aligned with what I want. And when I got into the situation and I ended up having an epidural, I ended up having a C-section, I felt completely lost and out of control. I had no idea what to do, and it made me feel powerless, and it made the whole birth experience way more traumatic, because one, I wasn't expecting that. Two, I didn't know how to navigate it. And three, I had no power. I had no way of knowing what was or wasn't necessary for me. And so what I do now with my clients, what I've done even in my second and third birthing out of hospitals, is I'm always preparing for if I have to be induced. I'm always preparing for anything that could come up, the what ifs, the unknowns that so many people are afraid of. We're preparing for those ahead of time so that nothing feels brand new. Nothing feels like a surprise. It may not be ideal. It may not be the path that we want to take, but we're not unfamiliar. We still get to make the executive decision. And that is what I wish I would have known the first time around, because I probably could have avoided so much of the trauma that I experienced. I could have avoided the C-section that was unnecessary. And I would have known my options, because I had already talked through them, and that my husband would be able to speak up for me because he already knew them. So it's really key to make sure that you prepare for all scenarios. And having that childbirth educator or the doula who's been there before can help you along your pregnancy journey to really help prepare you for all these scenarios and not just the perfect natural birth, because that doesn't always happen for all of us. Hopefully it does, but it's not going to be everybody's outcome. And so we don't want you to feel like you failed just because your story didn't go as planned. It can still be a positive experience and you can still feel in control if you actually know what's going on. The ninth thing that I wish I would have known as a first-time mama is that my baby needs to be with me immediately and as much as possible after birth. I remember even with a C-section, them taking my baby away from me, and I did not even see my baby's face for at least the first 5 to 10 minutes after he was born. And that is really hard because when you understand the birthing process, the physiological process, what is most natural and most safe, unless there is a medical need for baby to be taken away and have more resuscitation support, or bringing baby to your chest and being skin to skin with them as quickly as possible is so necessary for you, for breastfeeding, for your baby's body temperature regulation, their oxygen levels, your body temperature, your heart rate. And when my baby was not given to me right after birth, even though he came out crying, I wish that I would have known that. I would have spoken up. My husband would have spoken up and we would have been able to be skin to skin. I wish that I would have known how to advocate for my child to be as close to me as possible, because there's so many positive effects of that. It does impact your breastfeeding relationship, and being skin to skin with your baby really helps your baby get to know your scent. And knowing that they did not have to be in those blankets right away was also something that could have completely changed the dynamic of how we started our journey. And he was safe and he was fine, he was healthy, and we ended up figuring it all out, which was amazing. And if that is your situation, you'll figure it out too. But I wish that we would have just known we could have advocated for ourselves a little bit harder in that situation, rather than just like seeing our baby from afar and hearing him, but not being able to like hold him right away. Because that's a very traumatic part of your experience too. You've done all this work to get this baby here earthside, and now you're waiting to see him, and all these other people have seen them before you. And that's a really hard place to be emotionally, when you already feel like you've failed because you didn't know. You feel like your body failed you. You felt out of control and powerless, and now you don't even have your baby in your arms. Like, that was very traumatic for me and very emotional. And I would never wish that on anybody. And I make sure that my clients are also prepared for that too, because it's just not something you ever want to experience. And I don't wish it on my worst enemy, to hear your baby but not hold them. And that, again, it was only 5 minutes. So I know there's so many moms whose situation is worse when the baby has to go to the NICU. But no matter what amount of time that is, it is some level of traumatic for every mama. Even though it could be the best thing for their baby, it's still traumatic, and it does impact your postpartum recovery process. So I do want you to just know that you have the right to get your baby to you as soon as possible. And you can even have your baby come skin to skin with you immediately after a C-section, as long as they are breathing and as long as they are not unresponsive. And even if that is the case and they take baby to warmer, they can still get them to you like really quickly after the baby starts crying. So that is something that I wish I would have known, because it really took me a while to recover and to heal from that experience. Mama, if you are to this point, I am so proud of you, because that means you're really taking your knowledge and education seriously. But the last thing that I wish I would have known is that birth is beautiful. Birth is beautiful. And even though I had a very traumatic experience the first time around, I wish that I would have been able to understand that even a change to a birth plan can still result in a beautiful, positive birth. Bringing life to this earth is beautiful and it is amazing. And there's absolutely nothing in the world, no experience that compares to it, even if that is by C-section. But it would be really hard for you to understand that if you don't have the knowledge going into it. So that was a lot. I hope that this video was helpful. I wanted to have it more personal and really just kind of reflective of my own personal experience, because so many of you love the second and third birth stories that I share, but obviously it came from somewhere. So I hope this was helpful. I hope this gives you a little bit more knowledge. If you want me to walk with you, hand in hand, supporting you along a journey so you and your partner can do this together, make sure you schedule a consultation below for Work Your Birth, and we will talk through all of your birth plans. All right, y'all, I will see you on the next video.